everyone, to I think our fourth blab for Alternative Health Concepts. We're excited to have you here today. And before we get started, just wanted to hope everybody had a wonderful holiday season, Christmas, Hanukkah, whatever your preference may be, or if nothing, just hope you had a great time with your family and friends. My name is Mike Warren. I'm the president of Alternative Health Concepts. We're joined today with my father, which if I'm looking at the screen is to my right, so I think he's that way. I'm not sure, but
on mine, he's on your left.
Okay, so is that pointing? Is that pointing the right way?
No.
Okay, so he's over here.
No. There you go.
Okay. And we have below me, that should be right, is Terry Dickens. If any of you have been to our site and seen any of the testimonials, Terry's right there. Terry is one of the people that gave us a wonderful testimony about a product that we have called BioPro Plus. And we can get into that a little bit, maybe a little later. But the reason why we're here is not to promote our products. We're here to talk to you and to promote the idea of your body healing itself. And how do you do that? And how do you go about that with all the drugs and toxins and everything else that we're putting into our body? And lastly on our panel today is Wayne Dorban. Wayne is a partner of ours. He handles our marketing, our internet marketing. He does a fantastic job of that. He's got a great company and he's just a wonderful part of our team. Wayne is going to be acting as a co-host today, which I have to go ahead and make him that. So now he is a co-host and he can jump in and out as he needs or help people there. So Wayne, did you have anything we had before we get started? I'll get going. Did you have anything you wanted to talk about?
Just real quick, just for those of you that are on, we appreciate you coming here. A couple things, if you haven't done very much of this blabbing, is I've already followed every one of you, and it's kind of common courtesy. If you want, you can follow other folks and you can just go around to each other, and all you have to do is click on the icons that you'll see up at the top of the screen, and it'll come up and it'll show you a little bit about everybody that's in the session right now. And actually, you can even go back and find people that may have come here for just a tiny bit and left by just scrolling on the message bar on the right. You'll find some people that were here and gone, and you can actually just click on their names, and I'm sure they'd enjoy it if you followed them. One of the things that following does is it allows the Blab system to announce to those people that are following you anytime that you're doing a blab. So if you want to get notifications about this blab or others that you're involved with in the future, you might want to do that. I had a weird thing happen. I don't know if you notice, is right about here on my face, it looks like the screen's, there's not a line on it, but you can just tell that there's kind of a difference. Weird. So Sedona.
And we don't see that.
No, I don't see it.
We don't see that, Wayne.
Sedona Kelly already has done that and followed. And just like Mike said, after Terry gives a little bit of his story here, I think, and maybe we ask him a couple questions, I'll probably jump off and open this seat up, and anybody that would like could jump on in. And even if you'd like to do that before I do that, just put your comment over on the right. I'm going to try to keep my eye over on the comments, let Mike and Dr. Warren and Terry do the talking mainly here, and that way I can sort of keep up with you with any questions that you might have. And again, as Mike said, you can just do a /Q, and the question will go over there on the chat bar. It'll also come over here on the left-hand side of your screen, and you can see it there. So I think that's all I have, Mike. These have been so much fun. One last thing is, if you do have to jump off for any reason, there will be a replay. Blab actually, immediately when this is done, will create the replay of this. We'll also be actually editing it a little bit when it's over, just so we get rid of any glitches that might be in terms of the audio quality or video, or maybe they'll even sync Mike's mouth up with him talking. And I doubt they can do that, but anyway, we'll edit it. And we actually might even, one of the things we do when we edit is if anybody talks about some site or some topic, we'll actually have our editor go out on the internet. They'll probably find it, and they'll actually put some graphics or some images and maybe video up on the screen while we're talking, because it kind of gets old looking just at faces. And I actually almost did this one today by doing it on my cell phone, which I actually get better reception for these on my cell phone than I do on my laptop that I'm on right now. And actually was going to walk around and then maybe show you a little bit of our cold environment here in Colorado that Dr. Warren talked about a little bit earlier. Yes, it's in the 20s today, and I think we'll get down to about 0 tonight. So, and then lastly, something new to Blab, they seem to be adding things all the time, is that up here in the right-hand corner, there is a map, and it'll actually show sort of where everybody is that's online or that's listening right now, and is on with us. So it's kind of cool. And I'm the one, I think, kind of right there in the middle of the country. There's obviously somebody down in Georgia, it looks like, and maybe somebody in New York or up in that area, and then obviously these California guys that are on the screen here with me. So that's all I have, Mike. Go ahead.
Okay, great. Just real quickly before I turn it over to Terry, I want a full disclaimer here. My mistake, I put that we were going to be talking about COPD. For some reason, I thought that is what Terry had, and I went back and researched and talked to him, and that's not what we're going to necessarily be talking about, although what we're going to be talking about today is something that more people have than COPD, and that's chronic sinusitis. So I've got to put that disclaimer out there. If you're here to talk about COPD, please stay here. We're going to be talking about it, but it isn't the problem that Terry faced. It's a very similar problem that he faced and that he was able to overcome. So we're going to be talking about that a little. So Terry, real quickly, just kind of give us a little bit about you, about your background, and about kind of how we became to know each other with alternative health concepts, and then the problem that you faced. It sounded like it was terrible, and just tell us a little bit about you and what you did and what you found out with regards to the chronic sinusitis that you had.
Okay. Well, I've been plagued with allergies to start with for most of my life. And those allergies then start causing problems in the sinuses, hay fever and all that, some asthma with it. I've been to allergists a whole bunch of times. I've gone through several courses of the antigen treatment, which helps a little bit, but not a huge amount. And so I was having continuing problems with the sinusitis. I had 2 sinus surgeries, not recommended to do, really not a fun thing, very painful, extremely painful. And the other thing is that they don't give you a long-term result. They don't give you, it isn't something you can have the surgery and figure, okay, now it's cured.
So, hey, real quick, Terry, let me interrupt. The chronic sinusitis is a real severe inflammation in the sinuses, the way I understand it, right? So what was the surgery that they did? Was that to remove polyps, or was that to just try and open the sinus cavities? What did they actually do?
I think it's all that, and they always, everybody I know that has had sinus surgery, they also tell you have a deviated septum. So they break the nose and straighten it out. While they're at it, Dr. Warren can probably explain the physiology a little bit more of it, but they go in and they break some bones in the sinuses and open up the passages. But what happens with this sinus infection, just like a cold, you get a postnasal drip, the fluids run down your throat, get into your lungs, you start coughing, and therefore that's the relationship between the COPD. The sinus issues are respiratory, and if it's chronic, I suppose in some respects, people who have chronic sinusitis maybe could be said to have chronic, pulmonary issues in general.
Mm-hmm.
Lean back a little bit, Terry. We're getting the feedback.
Oh, I'm sorry.
That might be better.
Yeah. I'll be more comfortable too.
Great.
Yeah, we don't need to. Carrying me once is enough. No, you don't need twice or more. This, by the way, is the first time I've ever done this.
You're doing great.
Awesome.
I have no idea.
I think we just saw your wife or somebody go by. Tell her hi.
That's true. Her computer's in the office here next to mine, and so she decided to leave. And I told her when we started, I said, I'm going to do this, and if you walk behind me, you're going to be on screen.
Yep.
She didn't seem to care. So
okay, so I didn't mean to interrupt you. So you went through that surgery, and
so I'd been through the 2 surgeries. Kind of a side note on that, one of the drugs that's used effectively, actually, to treat sinus infections is in the fluoroquinolone family, Levaquin, and Cipro is related to that. And that works very well to knock out the infection. Unfortunately, my sinus doctor decided that was very effective and gave me kind of an open-ended prescription. She said, here's a prescription, fill it. And if the infection comes back again, just start taking it and give me a call, and then we'll just set another prescription up for you. So I took it, I don't know, 5 or 6 times, maybe over a year and a half or so. The side effect to taking fluoroquinolones is ruptured tendons.
Oh.
And so I ended up with a really bad situation. The arch on my foot fell. It's the posterior tibial tendon ruptured, and I had the most grotesque surgery you can imagine. I won't go into detail on it, but it was awful. Since then, the FDA has issued a black box warning on it, and doctors and pharmacists are supposed to warn patients. They ignore it, but they're supposed to warn patients of this possible side effect. And it's not an uncommon side effect. I was patient at the time, number something like 21 in my pulmonologist's practice. That included him. He had a ruptured tendon in his wrist that occurred from the same cause. Anyway, very, very bad stuff. So be careful with that.
So Terry, would you
yes
maybe expand on that a little? Because and I was actually typing something, and so I missed it a little bit. But the ruptured tendon occurred because of a reaction to something you were taking medication-wise. It really didn't have anything directly related to the sinusitis. Is that correct?
Well, it's only related in the fact that the medication,
right,
Levaquin, was the link between it. So I had the severe sinus infections. I took the Levaquin, which is one of several drugs in the fluoroquinolone family. And then as a result of that, a side effect of that antibiotic is ruptured tendons. The one most frequently ruptured is the Achilles tendon, the one on the back of your ankle above your heel. The next most frequent is the one that I was blessed with, and that's the posterior tibial tendon. It runs from the middle of your calf down the inside of your ankle, and then ends up about at the bottom of your big toe. Is that right, Dr. Warren, with my description here? I think that's...
If you were a horse, I could tell you, but I think...
Oh, that's right, yeah. I figured you knew about all this stuff too. Anyway.
Yeah, that's true.
This is one of those side effects, so that when we hear the commercials for all the different drugs on TV...
Oh, yeah, yeah.
In a tenth of a second, go by, including death and paralysis and loss of tendons, and all that sort of
I don't know. I don't know if this one has death as a possible.
I think they have. I almost think they have to say that on almost all of them anymore.
They got
After you have the foot surgery that goes with this, where they cut off the heel bone and move it over and make 4 other major incisions, you sort of wish that death was one of the side effects.
Good heavens.
It's a boilerplate thing, Wayne, and they include everything possible.
Right.
Probably even life after death. I don't know.
Yeah, there you go. Well, anyway, I didn't want to detract too much by taking the tangent on that, but truly, it's a dangerous thing, and it's more dangerous the older you get. So, if someone's 20 and they take Cipro or Levaquin, the chances of their getting a problem is much lower than somebody if they're 50 or 60. I was in my 50s, late 50s at the time I took it. And of course, when I started having pain in my ankle and arch and having trouble walking, I didn't connect it to the fact that it would have been an antibiotic. You know, you don't expect an antibiotic to rupture a tendon. So I finally figured it out, got the connection. That didn't matter, but I was glad I figured it out because I won't be taking any of that stuff again. My doctor told me that having had that, if I take it again, I will rupture another tendon. It isn't just a maybe side effect. It will happen.
So at the point you're at right now, after you went through this surgery, you've still got chronic sinusitis, I'm assuming, at this point?
Oh, sure.
That didn't even fix that, right?
Oh, no. Well, it's a Band-Aid. You know, okay. It's an antibiotic, and the infection comes back, and, you know, all the problems continue. So I was referred to go to National Jewish Health in Denver, Colorado. National Jewish Health is an outpatient hospital, I guess, or clinic. I'm not sure which.
It's a hospital.
Okay.
My big hometown, close to me.
Yeah. Oh, yeah. I spent 3 or 4 days there. It's considered to be the best pulmonary hospital in the nation. And so I decided I need to get this handled. So I went over there, and they tested me for everything you can imagine. They tested my swallow. They did all kinds of scans. They did another allergy test. And anyway, after it was all over with, they gave me several recommendations, one of which was they had me take a dose of something called budesonide, and I mixed that with a saline solution. I can't think of the name of the little bottle thing that I bought to infuse it into my sinuses. Doesn't matter. They make another one called Neti Pot. Somebody might remember the name of it. But anyway, I would buy these little saline or little salt packets, put it in some warm water, and then put an ampule of budesonide, and then rinse my sinuses with it. And it gave me great relief. It really helped. If I did it twice a day, at a cost of $800 a month, no insurance. Again, it was a Band-Aid. You know, it was something that wasn't going to cure anything, but it certainly helped a lot and made my life a lot easier. So then about 3 years ago, something like that, I met Herb Warren. And being a curious guy as I am, I always have to find out, what do you do? Where do you work? What kind of career you have? Yeah, that's the guy. Yeah, I think it is on mine. And I was fascinated with his background. I have a brother-in-law who's a researcher and professor at UC Davis, and I found out that Herb Warren got his doctoral degree from UC Davis as well. So we got chatting, and somewhere, I don't know how I mentioned it, but somewhere I mentioned that I had chronic sinus issues, and maybe I told him about the foot surgery. Who knows? I don't know. And he told me about this product that he was involved with, BioPro. And he mentioned that he had a friend or relative who had sinus issues, and so he had used this product. And of course, I jumped on it and decided I'd give it a shot. He told me how much it cost, and it wasn't $800 a month. In fact, I don't know if it was $800 a year. I think it's probably less than that. So I started using it, and I got a nebulizer. I don't have it handy here. I could run off and show it to you, but if my wife wanders by, I'll have her bring it in and show it. It's just little, hold it up underneath my nose, and it makes this real fine mist. And I just inhale the BioPro Plus, which is in a liquid form with a water-soluble silver. Amazing result. It just has helped enormously. I'll start feeling some sort of issue coming on with a cold or something like that. And so I start nebulizing again. I try to remember to do it periodically anyway, but I don't do it every day anymore because it's so much better. The other thing is that my wife's been taking the product also. We take a packet of it every day, and then take this little ampule with the silver and the powder in it that you mix up. Take that about once a week, or I nebulize that for the sinuses. And in addition to the relief that I get through the nebulizing, it really helps us stay well. We don't get sick like we used to. We'll still get a cold or something, but it'll go away quickly, and it won't be as severe. So I am most appreciative to have figured this out, and of course I've shared it with family and friends, and they've had similar experiences with it.
You know, the other.
Anyway, that's kind of my story in a nutshell.
And you're sticking with it. You know, it's interesting. I was in looking up what you took. The how do you say it?
Chloroquine.
Chloroquine is the family.
No. The second drug that
the products are levaquin and ciprofloxacin.
No, the drug the Jewish hospital in.
Oh, budesonide.
Budesonide. I happened to look that up. I don't know if you can see that or not. Just to look a little bit about it. And did you realize, talking about drugs and only a Band-Aid,
that's it. It's the purple package.
The side effects of that, there are 62 side effects that if any of them happen to you, you need to go to your doctor and stop using it immediately.
Oh, no.
And then there's another 45 plus that you're going to probably have while your body adjusts to this drug. Bottom line is, any pharmaceutical, when it's not synthetic like that, there's going to be side effects. And that's where we get into the whole idea of healing your body naturally. You know, the earth has given us so many wonderful, wonderful tools and things which we can use to heal ourselves. Natural plant products, animal products, which our product happens to be a glandular product, and it's a bioidentical product that your body produces. Don't want to get off onto that too much. You can check it out later. But the bottom line is, Terry, that you were able to heal yourself, not from these terribly, terribly expensive side effect ridden drugs. You were able to do it naturally with your body healing itself and taking care of it. And conversely, you don't have any side effects, and you don't have any long-term residual effects that are going to get you downstream, like your tendons going out or whatever might happen. So
Yeah.
that's what we're all about.
I guess the side effect is better health.
Absolutely, if you want to look at it that way. It's,
What's wrong with that?
Yeah, exactly. We talk about that almost every blab, that our bodies are a perfectly designed machine to fight off anything, whether it be a cold or virus or to the very extreme cancer. Our bodies produce hundreds, if not thousands, of pathogens or cells every day. Our immune system comes in, gobbles them up, spits them out, and we keep going and we stay healthy. It's all the trash and the toxins and everything else that we put into our body that are what really, really cause us the problems. From the food that we eat to the drugs that we take, all of those things being toxic, the air we breathe, the water we drink. What we're talking about, and one of the things is that there is no magic bullet. There wasn't a magic bullet for you. You had to make some lifestyle changes. You had to do your part to help your body heal itself. And that's what we're trying to get out to people, is that, hey, you think there's a magic bullet, you just want to take that pill because you've got cancer or you've got some major sickness. Got news for you. It ain't going to happen. It's just not. You have to dig in, do the research, find out what you can do to help your body heal itself. And it will. It's absolutely amazing. I myself have made some changes in my lifestyle and have really gotten rid of a childhood. I think I was diagnosed, my dad could verify it, somewhere around 9 months old with asthma, severe asthmatic all through my childhood years and into my adult years. And now I don't take the albuterol, I don't take the Advair, I don't take any of those things because of some lifestyle choices that I've made. And making sure that I am taking the right supplements, that my body's getting the right nutrition. So again, that's what we're all about. And that's why, Terry, you were such a great testimonial for our company, because you did do one of the things that helped, and that was you focused on your immune system. And by starting and focusing on your immune system, you got to the point that your body was able to alleviate those symptoms, because you did what? You got right to the root cause. And that's the big thing you got to do.
I don't take albuterol anymore either.
Yeah. And that's got all kinds of side effects. I've had high blood pressure since the age of around 28, 29, something like that. Some of it may be genetic, obviously, but a lot of it was because of the drugs that I was taking for my asthma. They stimulate the heart, and they do all kinds of different things. Side effects, again, in stimulating my lungs and helping my lungs to open up and breathe freely. It also was detrimental to other areas. So it is interesting. Steroids do that, absolutely. What's your name? Rob. There you go. Rob, absolutely. And that was part of the thing that I was on Advair, which is a steroid, twice a day. And I was taking that morning and night, along with the albuterol and everything else. It just piles on, and that's another problem that we have with our medical society today. One of the problems that they tell you, that there's all these side effects from the drugs, but what they aren't telling you is that there's side effects on drugs being piled on drugs. The average American, I think, last thing I read was the average American takes somewhere around 3 prescriptions a month or a day. They take 3 per day. The problem with the testing that they do on all these drugs is they don't test one drug against another in combination. There's no way you can do that, because there's literally thousands and thousands and thousands of combinations. They couldn't do it. So that's why they have to throw out all these side effects, because they don't know if you're taking this drug with this drug, if you're taking a steroid with a particular vasodilator, for example, what the reaction's going to be. They don't know that. And so you're taking a toxic soup, and you just start taking all these prescriptions. Again, bottom line, find out what you can do for yourself and what natural alternatives are out there for you. You don't have to get a drug or a pill for everything.
Right.
There are needs and there are times when it's absolutely beneficial, and I'd never ever recommend anybody do something that their doctor tells them to do or go against that. But what I will tell you is that a doctor has never healed anybody of anything and never will. The only thing that's going to heal you is yourself, your body's own innate ability to get in there and heal itself. And if you'll understand that, and you have to be your own advocate and not just get up in the medical arena in this big, huge machine that we call big pharma or big medicine or whatever you want to call it. You got to be your own advocate, and you've got to understand what's good for you. Even though your doctor may recommend it, he's probably spent all of about 7 minutes with you in the last 3 or 4 months. You know, he doesn't know you better than you know yourself, and that's what we're saying.
Michael.
Yep.
Rob,
sorry to get on that little rant.
Yeah, well, that was a rant. Rob had a question about steroids, and the problem with steroids, I mean, they do suppress symptoms, but the problem with all steroids is that they eliminate your cellular immune system, which is the main source of keeping your body healthy and well. And when you take your first steroid, it's neutralized your immune system dramatically. So steroids are fine to keep down the initial inflammation, but you got to know that over a period they're going to depress your immune system to the point where you're going to be open for other secondary kinds of infections. And that's one of the problems with, like Terry's had, and all people with respiratory asthmatics and other, when they're taking these steroids and their immune system is not active, you're going to get those little secondary infections that your body could usually take care of, and now you can't. So you're going to end up with these sinusitis, and even worse than that, you'll end up with some things that are even more serious, possibly. So steroids are fine in their use, but after the steroid treatment is over with, you better get on an immune supplement to get your immune system back up and running.
Yeah, absolutely. Donald, welcome.
They mask the symptom. Hey, Donald.
Do you hear us? Your screen's frozen, I think, so it might be a connection issue. We'll come back as soon as you're there.
One more question. Rob's got a question. He's getting off prednisone. Well, and that's fine, Rob. You don't want to just get off of it cold turkey. You want to wean yourself off over a period of time. And even though the BioPro doesn't work as well while you're taking the prednisone, it's still you can still help your immune system even taking it with the prednisone. So it just won't work as well because it has to do double duty to overcome the effects of the prednisone. But be sure you wean off of it and don't just call cold turkey, and that'll cause other problems.
What kind of problems does that cause?
Well, it causes your whole system to go like. Your system will kind of crash. It'll cause different organs to do different things. So you may end up with an intense immune response. So you want to just go wean it off over a period of time.
Yeah.
And I would recommend you talk to a doctor before he does it.
Mm-hmm. Yep. Obviously, you have to have a doctor prescription to get on prednisone, so you need to
right.
be best to have a doctor monitoring you to go off is what you're
saying. We can't give any medical advice on here anyhow, just other than get your doctor to go along with you.
But and we don't want to tell anybody that, but what we can tell you is that there's amazing products out there that can help build your immune system, that can help your body get back to its optimal position and working the way it's designed to do. And that's the key. And again, drugs just don't do that. They just only cover and take care of a symptom. So that's why it's really important to find out for yourself what some of these areas are. And there's amazing areas. That looks good.
Got Donald back. Hey, Donald.
Good looking guy.
Welcome, Donald.
We saw you move there for a minute and then it kind of froze up.
Yeah, he's frozen again.
Audio only. It must be a internet. Yeah, it says audio only, poor internet signal. So
well, maybe we can hear it.
Yeah, try and talk maybe.
Try and say something, Donald. God, doggone it.
It's nothing. It's maddening when that happens. So it's
Yeah.
so frustrating. We're not going anywhere, Donald, for at least 20 minutes or so. So try again, or try. I'll keep you on there right now and see if it's something there in your signal. It looks like you went outside, so maybe you were trying on your phone. Which, by the way, on my phone it seems to work better. Is my voice still not even close with my lip syncing?
Not even.
That's funny. On my screen, it looks like it's synced together. That's what's weird.
Well,
Yeah. So Terry, where are you at now? How often do you use our product BioPro? Do you use it weekly, daily, monthly? What do you do now as a maintenance type regimen?
Okay, so prior to about 10 days ago, I was nebulizing maybe twice a week. I was taking the oral product every day. 6 days a week, I would take a packet of BioPro Plus. I think that's what it is. And then on the 7th day, I would take one of these little vials, which is, I think, 5 times the strength. Right. And then about 10 days ago, I started getting a cold. So I've been pretty faithfully on the daily I've been taking more of the vials. I've been taking them about twice a week. And the whole thing is almost gone now. I'm 90% well again. And I didn't get horribly sick during the process.
Excellent.
So it hasn't made me totally immune from illness.
No.
But it's made me less susceptible, so I don't get sick as often. And if I do get something like a cold or whatever, it goes away fast.
Yeah, that's something that is, again, it's not a silver bullet. BioPro Plus is not a silver bullet, but it builds your immune system so that it does its job, and that is to fight off viruses and bacterial infections, cancer, HIV. When any of those other things set into us, it helps that. It helps mitigate that. It modulates our immune system so that our immune system can fight those diseases off. Something that's going around here in California, I've got several of my buddies that, we meet together weekly and we ride motorcycles together and stuff. And they literally, all of them, with the exception of 2 or 3 of us, me being one, have got this bad, I guess it's a virus, because the antibiotics, they aren't giving them antibiotics. But they're literally taking 3 or 4 weeks to get over it. And I had another buddy that I gave some of the BioPro to, and he felt better within about 3 days. So he still got sick, and he got pretty ill, pretty bad, but he was able to fight it off and get well quicker. And that's the other benefit of the BioPro. So it's one of those things. Donald, I see you came back in. If you're welcome to jump in that seat if you think it'll work. Yeah, feel free.
On mine, it says he's open.
Huh?
On my screen, it says it's open still.
Yeah, so anybody can jump in if you have a question. You don't, if there's an open seat there, for those of you that are new to Blab, go ahead and jump in there if you have a question. Looks like we have somebody coming in right now, and they're brand new to Blab, so they're probably wondering what this is all about. Miss Days, it looks like. See, it takes a while for them to get on sometimes. Avid Periscope. Periscopers, but new to Blab.
Hi, everyone. How are you?
Great.
Hi, Miss Days.
I have a question about plant-based diets. Do you think that's helpful at all? I eat fish, no red meat, but I was wondering if the plant-based diet has any bearings on your health or makes a difference at all.
Well, I'll jump in there real quick from my own experience. I've tried both. I believe that the best, and see, the problem we have with diet is that they're finding now, and there's every individual body, your body is made up differently than mine genetically. We have a lot in common, but your body will respond to certain foods differently than I will. What I would suggest is that you try some of the diets that are out there. And really, they aren't diets. I don't consider them diets. They're lifestyle.
Right.
If you're comfortable with it, try it and go with it. I know that because we do a lot of research in the area of cancer, because that's one of the areas that is the most immune repressed areas. Is when you get cancer, your immune system goes right to the bottom of the barrel, so to speak. And so I know that through my research that plant-based diets are one of the best ways to get the nutrient-dense micronutrients, phytonutrients into your body the quickest. With that said, I believe that we should be eating lots of greens. I personally, and I've been losing weight doing it, so I know it works. And I know my body's getting nutritionally the nutrition it needs because I am losing weight. I have at least one green smoothie a day that I make. We went out and bought a good blender and doing the whole thing, because that way I can pack that full of nutrient-dense vegetables. I go very little on the fruits because of the sugar, and I go high on the good quality fats, coconut oil, olive oil, grass-fed beef to a lesser extent. And so I would say what you're doing is important. Plant-based as being your base, and then adding some fish, some chicken. But again, you got to be so careful with that. Make sure your fish is wild caught, not farm raised, because they'll put antibiotics in it. They'll put steroids in it. The same thing goes with your chicken, your beef, lamb, any meat product. Make sure they're free range and organic. And even your vegetables, try and go organic and stay away from the GMO stuff. That's my 2 cents on it. I wouldn't say that one is better than the other. And I've seen people that swear by any of those extremes, from extreme veganism to extreme meat only people that are pure protein, super high protein, to super high fat, which is a ketogenic diet. So I hope that answers your question. I'm not sure if it does. Yeah.
Yes, it does. Thank you so much.
What works for you? I mean, what do you feel good on? That's what you really should be doing.
Okay, that's what works for me. I don't really know. I'm trying to understand my diet still. So
one of the ways to do it is do an elimination diet. So first off, if I was to say one thing that you should do right away, get off all processed foods. If you can get off all processed foods, you'll feel better right away, I promise. And then what I would do is what I did is I would try and wean yourself off of grain products, because of the way they they turn to sugar so fast in your body recognizes them as sugar, plus all the problems with any wheat-based product. And if you're going to take away grains, start with eliminating wheat and eliminating gluten, because if you do that, you're going to feel better. So
Terry can tell you about gluten.
Yep.
And did you do that, sir?
You'll drop off the GMOs.
Yeah.
Okay, very good. You guys were so helpful. Thank you so much, guys.
Ms. Daisy, I believe in moderation in all things as well, and I'm not adverse to eating some red meat, because that's the only true source of carnitine you can get, which is essential for heart health. So don't eliminate red meat. However, I would, like Michael said, I would limit it to grass-fed beef only.
Okay, very good.
Or grass-fed buffalo. That's another good meat. So, but
Awesome.
your fish and chicken is a good. And then what you're doing with the vegetables sounds good to me.
And Sedona wrote
Thank
avocado. You. Absolutely, I eat a half avocado every day.
Avocados are great.
At least half an avocado every day.
Avocados are
okay.
And you might even put a little turmeric in your spices, because that's coming up with a lot of different advantages with turmeric now. The curcuminoids.
I do drink turmeric tea.
Nice.
Yeah,
Oh,
turmeric
good.
tea is what I have every day, so it's pretty good.
Wonderful.
Yeah.
Well, you know more about that than I do then.
I got it off of Amazon. It was pretty affordable.
Yep, that's amazing. How do you like this? You're brand new to Blab, it said.
I'm brand new. I was trying it out. It's been wonderful. I really appreciate your advice. I have to kind of jump off. I'm about
No
to
problem.
do one myself, but it was so helpful. Thank you guys
You're
so much.
welcome.
Do you do this every week?
We do. We have one every week. So if you click on the little at the top of the browser, you see everybody that's in the room. You can
Yes.
click on everybody and you can follow them. You can follow me just by clicking on my name on the screen, and then you'll get notified of every blab that we have.
Okay, got
I
it.
followed
Thank
you.
you,
You can
guys.
follow me. You're welcome. Have a wonderful day and have a happy new year. Happy New
Bye,
Year.
guys. Happy New
Bye-bye.
Year.
Bye-bye.
Okay, so that's how it works for you that are new to Blab. And look at her. She's brand new, first day, jumped in the seat, jumped in the hot seat and asked some
How
questions.
about that?
Any of you are more than welcome to do that. So you're not the only newbie here, Terry,
Yeah,
even though you're pretty new.
yeah, that's for sure.
You're an old timer now. But you know, Blab's only been around for about 4, maybe 5 months, I think now. And it's still in its infancy. And they're changing things daily. It's changing really, really fast. They're getting a lot of people coming on. So it is an exciting platform. It's a lot of
Michael,
fun.
we have a couple of questions. Michael,
I see it.
I can't tell when your mouth is still moving, but you're not saying anything.
I can just do this.
We have a
There's
couple
gotta
of
be a
questions. We have a
about
couple of
that.
questions about the tea that she mentioned. It's a turmeric tea, and there you go. I ran across the thing on the other day about making. It's a recipe of using turmeric and coconut oil, and putting that together, and you refrigerate it. It becomes like peanut butter. You put it in your drinks, or just eat it right out of the spoon. So turmeric is getting to be the herb du jour, it looks like. So,
Huh.
but it's got a lot of. They found that turmeric has the ability to, from research, to help remove the beta amyloid plaques out of your brain, which is, if it does that, it turns out to be true that that's what it does. It can be very important for Alzheimer's and maybe some other things like Lou Gehrig's disease.
Yeah, I don't know if you can see on my screen. I got some of this just last week. Actually, it's interesting, and I've been drinking it every day myself. It's a turmeric tea and ginger, and I got it at. They have Sprouts here in Southern California. I don't know if that's a national chain or not, but pretty much any health food store type of place that sells any variety of tea, you can get that now. I think it seems to be a good way to get the tea. This one's actually, the company's called Rishi, and it's organic herbal tea, turmeric and ginger. So, and I like it. It actually tastes pretty good. So there it is again for you to see. So yeah, turmeric tea is a great tea. They're finding, like you said, so many great things about it nowadays. It's an amazing, amazing thing. Another gift that the earth has given to us, to help our bodies heal themselves. Hello.
I've been taking turmeric supplement, but not the tea.
And that's good. The supplement's good. Wayne's back on.
He came back.
Yeah, guys, there's a question that we see over here from, let's see, where was it? Boy, it's going quickly here. It was about glutathione. She asked about glutathione. So
yeah, in fact, I literally was putting it up on the screen, and then you jumped in, Wayne. So if you jump back out, it should pop up here, and then my dad probably could answer that or speak to it, unless you can or you would like to.
no, I'd rather you guys talk about it. So.
Well, glutathione is one of the major detoxifiers of the body, and it's a end metabolic process of glutamine. So, but glutathione herb supplements are very important for to keep your liver clean, and you got to keep the filter clean in order to keep the fuel going to the right spots. So, yeah, glutathione is and other than that, there's a lot of different supplements around, and you want to get the best quality you can.
You see that there's a question here. Is it a precursor to testosterone?
I I don't. That's beyond my pay grade. Not that I know of. It could be a possibility that it's in order to. It may have some, relationship there, Wayne, but I don't know. I'll have to do some research on
I
that
have a
one.
question for one of our
Could be.
attendees that's out there, and it's at Craig Peliquin. It looks to me like he's put up the name of something online here, Shishandran B, from the Shishandra berry. Craig, I'll jump out here if you'd like to jump in and tell us a little bit about that, because I see that it looks like you're involved with a company that's up in Canada that's actually moved here to the States, and maybe you could tell our audience a little bit about that. If so, I'm going to jump out, and if you want to jump back in here, you can do it.
Hello, can everybody hear me okay?
We can.
Hey, Craig, how you doing?
Just great. I just heard about this from Kathy. She was saying, hey, Craig, jump on this blab.
Great. We're glad to have you.
Great.
So tell us about yourself and what you're all about.
I'm up here in beautiful Vancouver, British Columbia, Canada.
Oh yes, nice
It's
place.
a beautiful sunny day, and yeah, we don't freeze up here in Vancouver. We do rust though.
Yeah, that's for sure.
Although we haven't had a heck of a lot of rain. We've had a remarkable winter so far. It's been great, and yeah, I mean, I'm always if I see stuff about anything to do with any chronic age-related diseases. My background is not in this arena. It's in direct sales. I actually started off my career as if you can believe this, I was a clown for a tiny little fast food restaurant with golden arches.
I'll be dang.
Yeah, you may have heard of them.
Yeah.
Yeah, yes.
So if you ever heard, you saw Ronald McDonald from 1986 to 95. That was yours truly.
Wow, wonderful.
Yeah, so a little bit different. So yeah, as an entertainer in that, but I was introduced to a company here 2.5 years ago called Glissandra, Vancouver-based company. Started all their research here at the University of British Columbia, and our founder, Dr. Ko, is now the Associate Dean of Science at the Hong Kong University of Science and Technology. And that's
Wonderful.
where they have been working with something called Shishandran B. So it comes from the Shishandra berry. Don't know if you guys have heard of the Shishandra berry or not. It's an adaptogen. It's grown in northeastern China. It's where we get it's actually grown around the world, but we get our active ingredient from the most potent that we found is in Russia and northeastern China. And the literal translation from Chinese to English, Chinese is Wu Wei Ji, and it stands for fruit of 5 flavors. Because when you eat it, it's bitter, sweet, salty, pungent, and sour all at the same time.
Same time.
Basically, it tastes awful.
So how do you take it?
A little bit of sugar.
Well, actually, we've encapsulated it. So once it's in a capsule form, you don't have to taste the berry. It's not so bad. And it's also in a topical serum. So it's both a skincare line and a supplement. But it's been 24 years of research and development and about $100 million in research grants at the university before this product was able to come in the market. We got FDA approval a few years ago, just got Health Canada approval, and we're just now sharing it. And when Kathy asked about glutathione, and you're right, it's the body's master antioxidant. What Shishandran B has been proven to do is the redox cycling of the glutathione. So it actually recycles our body's own glutathione to bring it back up to the levels of when we were kids and teenagers. And that's the difference between an antioxidant and getting your body's master antioxidant to do its job. So a little bit different. That's kind of, that's the Shishandra berry and what we're doing.
Nice.
As far as an adaptogen goes, what have you shown to stimulate any lymphocyte production or any along those lines?
It is an NRF2 activator. But then a lot of things will stimulate the NRF2. I mean, heck, chocolate will stimulate your NRF2. You eat enough of it. The main thing here is going after the mitochondria. So mitochondria Now, many of your listeners may or may not know that's the energy producers in the cells. See, my job as the VP of this company is to dummy down all the science so that I can understand it. And if I can understand it, then anybody can understand it. They produce the energy, but at the same time that the mitochondria produces energy in our cells, the byproduct are free radicals or oxidants. So the body's glutathione is the best at attacking the oxidants or free radicals before they do damage, because glutathione works at a ratio of 1 glutathione molecule to 1 million free radicals. So it eliminates the damage before it happens, kind of like closing the barn door before the horse gets out.
Exactly.
Then once the horse is out, that's now what we do with antioxidants. Because they work at a ratio of 1 to 1. So vitamin C or vitamin E, tocopherol, aloe vera, turmeric, many of these that we're talking about here, they're great antioxidants, but they only work at a ratio of 1 to 1, one molecule to 1 free radical. And when they combine, then it spins off another electron, and then the whole thing starts again. And we all know, well, we don't, but there's billions of free radicals are produced every second in our body. So in order to effectively win in the battle of aging and disease, we need to be able to go at the source of the problem instead of merely masking the effects. And that's where Schisandrin B comes in. And more scientists now, I went on to PubMed when I first looked at the company, because I don't ever listen to any company's propaganda. I don't go to their website. I want to get independent science. And I typed in Schisandrin B in PubMed 2.5 years ago, because I wanted to know if there was real independent science behind what these people were telling me, because I never take anybody at their word. And I figured if there was a dozen papers on PubMed, I'd be impressed. Back then there were 140. Today over 210 on what Schisandrin B does. And more and more scientists now around the world are following Dr. Koh's work. And it's all from this berry. And then our supplement adds in 2 other traditional Chinese herbs, which is shistanchi and cinnamomori. I don't know how much you guys are into the TCM, traditional herbs. I know I knew nothing about them. Yeah. I didn't know a traditional Chinese herb from, from oregano.
Let me jump in there, Craig. One of the things that we do, we have a website called Alternative Health Concepts, and you can go to it and see it. We'll put up the thing, but we have a product that is that we manufacture that is a replacement. Basically, it's a bioidentical supplement that your body makes. All of our bodies make it. You're talking about Schisandra berry and the good things it can do. The product that we have happens to be a thymus gland protein that your thymus gland and every mammal's thymus gland produces until we're in humans about the age of 40. And what that is that protein is the regulatory protein for, it stimulates the CD4 cells to go out and find pathogens in our body. So as you said, we're producing billions of free radicals. Well, we're also producing hundreds, if not tens of thousands of cancer cells every day in our body. Our body's own natural immune system goes out and gets those pathogens and destroys it, kills it. What our protein does is it stimulates the CD4 cell to find those pathogens and then go and find the CD8 cell to come back and kill it. The CD8 cell is a natural killer cell in our body. Same thing, kind of similar, science-based, been known about this protein and its critical importance to our body since probably the early 50s. And many papers. And the nice thing about our product is itself. It's not something that is outside. It is the exact same protein, and we've isolated 5 proteins that are out of 50 that the thymus gland produces or thereabout, that are critical to that modulation of our immune system. And that's why we have scientific papers that show white blood cell counts raising within 48 hours. We know that it does it scientifically. In the lab, it does it in people and through their own. So in vivo, in vitro, it does it both. So it's exciting to hear what you're talking about, because it's a complement. Like I started out, I don't know if you were here, there is no such thing as a magic bullet. There's not one product that's going to do everything. We have to figure out what works synergistically together and pull those together to better whatever ailment we might be fighting. And that's what's exciting about our product. It sounds similar in one sense, that it has to do with the immune system, and that's where it all starts. If we can.
Well, our product is synergistic, Michael. With very our product is very synergistic with adaptogens. That's why I brought up the point. It's they work hand in glove.
Yep.
Well, and that's the thing too, is our bodies were meant to be able to self-heal.
Yes.
Exactly.
And an adaptogen allows your body to get into the state to maximize the ability to heal itself.
Right. If it has the right tools.
You got to be able to do that. And that's, I mean, and that's the difference. I mean, you know, it's also the difference between Chinese medicine and going back over 2,000 years and Western medicine. Western medicine is cut out the cancer, and Chinese medicine is prevent it. Put your body in a state to prevent it. I mean, how come you never tell how old Chinese people are? You know, you ever notice that? I mean, you never can tell how old they are. I mean, because they've had thousands of years of these herbs. They've lived on it. They understand that. It's about preventative medicine. And you know, Western science, we're all about, you know, we want it fast. Just, you know, give us a pill, get the headache to go away. You know, give me a Big Mac. You know, I'm really, you know, we're all in a microwave society. We want instant results. I see a question from Wayne. Has anybody ever heard of the company Nerium? I happen to have. I mean, it happens to be my business. I have to know about all the different skincare companies. Nerium has their active ingredient comes from the Nerium oleander plant or bush, which is a known poison. That's what they put into their product. I researched Nerium at the same time I was researching the Schisandra berry. I couldn't find any independent science behind their claims of what it would do to make you look better. That was the only thing there. I found their own scientists talking about how great Nerium oleander was. I guess the Canadian government didn't agree, because when they tried to bring their product to Canada, Canada wouldn't allow their product into our country. Health Canada said, no way, you're not bringing Nerium oleander into our product as a supplement or as a product for the skin. But that's the, you know, the different. I mean, Health Canada has the strictest standards. You get Health Canada approval, you pretty much get to go anywhere in the world. Nerium did finally come into Canada, but they had to remove Nerium oleander from their formula. Then they put in aloe vera instead, changed the name, and they made a new product. But that's what I know about Nerium. One of the fastest growing direct selling companies, broke just about every record 2 or 3 years ago, did a fantastic job of marketing. I just didn't see a product that was going to last long term, because I didn't see the science behind it. But that's just one man's opinion.
Craig, listen, we really appreciate you coming on today. We're at the top of the hour. In fact, we're a little bit past it. So we're about ready to wrap up our blab for today. And please follow us if you haven't already. And let's get together.
Yeah, absolutely. Thanks for having me come on. Wonderful meeting you both. Nice to see a father and son team working together. That's fantastic. I'm going to go to your website and learn a little bit more.
Great. Appreciate it.
Give us a call.
Thanks a lot.
Good luck.
That was great. Terry, I know that we're at the top of the hour, and I know that you may have things to do. Are you good on time, or if you want to go, we need to be wrapping up here quickly.
I need to go shortly.
Okay, that's fine. Then let's wrap this thing up. Dad, did you have anything to add that you wanted to?
No, I thought it was an interesting conversation today. A lot of good things came up.
Yeah, I'll just say to finish off here, anybody that's still on, and Kathy, so thank you so much. You threw a lot of really great info in here, and Craig was great, and we had Colin and Chris come on here near the end. Again, just recommend, at least to anybody that's on, just go up there on the top and click on everybody's picture and follow them. because I know some of you are going to be doing blabs yourself. We had a new person on today that joined us that's been on Periscope and does different things there. That's another one of the live cast media that's out there. All of these are great media. We're actually going to start sometime into the new year doing simulcasts where we use another platform called Webinar Jam that we'll do alongside this one. And we, you don't have to figure out which one to go on to. We'll just have different audiences that are on one versus the other. And remember, there will be a replay that'll be up on this almost immediately after the presentation here. So you can check that out in the replay section. Also, I made a few comments while Craig was talking and while we were talking about other things about when there was questions about eating different kinds of foods. We had two amazing blabs. The last two that we did, this one's amazing too, but that we have the replays on from Nancy Mendez and with Tyler Allen. Nancy is
Barbara Mendez.
Barbara, that's right. I keep calling her Nancy for whatever reason. But she's got a wonderful blab that you can go listen to the replay about. And then last week we had a gluten-free discussion with several people that have found out they have celiac disease and just other things that are creating problems for them. So that's what's so cool about this. You can go out there and listen to a variety of different platforms and different things about it. So that's all I have. It was great today with you, Terry. Thanks so much for coming on with us.
Thank you.
I got a question, Wayne.
Sure.
I got a question, Wayne. Are the when you get these blabs refined, are they going to be on the website where people can go to the website, archive them on the website?
Yeah, they will. And
They actually are now. I think we're up. It takes a while for the editing to be done to get it onto the website. I think there's 2 or 3 on the website today. When I looked at it prior to that, it's a new tab up there that says media, and you can click on that and go back and watch the replays there.
Oh, good.
Also, Alternative Health Concepts has a YouTube channel. You can look us up there, and the blabs are also posted there. That's the beauty of the blab is that they automatically allow you to upload it to YouTube the minute this is over. So we put it on our YouTube website also. So that's just a little insight for some of you that may not know that.
Craig put over here at Craig put over in the comments section. It sounds like his change from a before and after might be interesting. So he put a website up over there that we can look at. And
awesome.
Well, it sounds like Terry needs to jump off. I actually have to jump off here. And so, guys, this has been great. And again, Happy New Year to everybody, by the way. It's probably not going to catch the people online before that. And then we'll have another one of these next week. We haven't gotten into a rhythm where they're all exactly at the same time every week. We're going to get into that as we start the new year. But this is fun. We always get to meet new people. Make sure to go up and like everybody. I see we have somebody else brand new on. I'm going to welcome them here. And boy, we got a lot of people today that are just brand new onto Blab. That's very cool.
I think Blab is
do you remember this green little tab in the past? This is the first time I've seen this. So
it's been up for about a week now. I've noticed that.
What's that, Michael?
Where it welcomes them in the first day.
Oh, yeah.
So the first day they come on, every time they go into a new blab, it'll show them that sign, and you can welcome. You can actually click on it, and it automatically welcomes them.
By the way, I got to apologize, but the script that is in their name there, I can't get. But you ought to come, and we followed you. You can follow us, and we'll be able to share some things together later.
Yep. Terry, did you have any final parting shots of your first day on Blab?
Yeah, it was fascinating. I love being on it. Thank you for inviting me. And I'm going to hold good thoughts for the bowl game tonight.
Which one is that for you now? For Wayne's bowl?
Yeah.
Who are you playing, Wayne?
It's in the Arizona Bowl, and they're playing. Wow.
Put him on the spot. He just knows they're going to win. He's not worried about who they're playing.
Yeah.
Not positive who they're playing. Air Force, actually, another team we follow here is the Air Force Academy, and they were playing while we've been talking here. They're playing California, actually.
Oh, that's right.
Good.
Cal Bears.
Well, it's a great time of year, and next year will be a great year.
Yeah, just final shot for me. Just wishing everybody a happy and prosperous, and more importantly than all of that, healthy New Year. You can take control of your own health and do what you need to do to get healthy. And don't let anybody tell you that you can't become healthy, no matter what you're facing, because you can. And your body can heal itself.
Everybody just needs to go to your website and get some BioPro Plus and stay healthy.
Thanks, Terry. Appreciate it.
Thank you, Terry.
All right, guys, let's call it a wrap. We'll see you all next year.
One thing about the cold weather back there, that alpaca's growing good hair coats.
Good grow, good hair. They go good hair. That's
Yeah, we need to have a blab about that, Wayne, because that's something that Wayne has an alpaca farm, and he raises alpaca. And that's got to be an exciting thing.
Interestingly, Dr. Warren, you're going to be hearing more about this. They're finding at Colorado State and at Rutgers and several places that camillid blood has some characteristics that is not found in other mammals, and they've been finding can be excellent in terms of some things they can do with platelets and other things for human purposes. So
wow,
it's kind of some neat research going on. That again, you don't have to kill it out back to do it. You can obviously do some.
One thing about that that I can tell you for sure, that BioPro Plus is an excellent adjuvant for increasing platelet counts. We take people that have platelet deficiencies, and we can raise those platelet counts in 48 hours dramatically. So
I'm going to jump, guys.
Okay,
see you later.
Talk to you
Have
later.
a great day.
Terry,
Bye-bye.
talk to you later. Dad,
Thanks, Terry.
as
Thank
always,
you.
Great
See
to
you
have
later.
you. Thanks, guys.
Yeah.
Appreciate it. Thanks for joining us today, everybody.